Hello, everyone. We are here to discuss irritable bowel syndrome, a condition many of our patients face. We'll explore how traditional Chinese medicine and acupuncture offer a holistic, evidence-based approach. Let's begin by understanding the global impact of this challenging condition. Irritable bowel syndrome is a functional gastrointestinal disorder. It is increasingly understood as gut-brain axis dysregulation. Patients often develop visceral hypersensitivity and abnormal gut motility. Because there are no clear structural abnormalities, long-term management remains challenging. This makes IBS particularly suitable for integrative medicine approaches, including acupuncture and Chinese herbal medicine. Conventional treatment often focuses on symptom control. Medications may reduce pain or regulate bowel movements temporarily. However, recurrence is common and the long-term outcomes remain limited. These features suggest that IBS is a systemic functional disorder. This is where traditional Chinese medicine offers an alternative perspective. In traditional Chinese medicine, IBS reflects functional imbalance of multiple organ symptoms. Liver spleen disharmony is commonly observed. Emotional stress disrupts liver qi, affecting digestive function. Spleen deficiency leads to impaired transformation and transportation, resulting in bloating and irregular bowel movements. Over time, systemic regulatory imbalance develops, contributing to chronic functional symptoms. This aligns with modern understanding of gut-brain axis dysfunction. Traditional Chinese medicine emphasizes holistic regulation. Rather than focusing on isolated symptoms, traditional Chinese medicine evaluates systemic imbalance. Pattern differentiation guides individualized treatment. This approach allows acupuncture and herbal medicine to address root-level dysfunction. This conceptual framework complements modern integrative medicine. Acupuncture doesn't just alleviate symptoms, it fundamentally retunes the body's internal communication systems. We are talking about modulating the gut-brain axis, which is the core of IBS pathology. This means we are directly influencing how the brain perceives gut signals and how the gut responds. It also reduces visceral hypersensitivity, essentially turning down the volume on pain signals from the gut. And critically, acupuncture helps normalizing gut motility, addressing both the too fast and too slow scenarios. These actions highlight a sophisticated interplay, moving beyond simple symptoms relief. Building on those profound mechanisms, acupoint selection is a highly personalized art, guided by the patient's unique presentation. We don't just pick points, we craft a prescription to address their specific imbalances. This means we are directly targeting the gut-brain axis, aiming to restore its optimal function. Commonly used points include stomach 36 to 三里 for digestive regulation, spleen 6 三阴交 for systemic balance, stomach 25 天枢 for intestinal regulation, liver 3 太冲 for stress-related symptoms. These points regulate gut-brain axis function and visceral sensitivity. And as I said, point selection varies based on patient presentation. Chinese herbal medicine provides multi-targeted regulation. Commonly used formulas include 控泻药方 for liver spleen disharmony, 真灵白术散 for spleen deficiency, 四神丸 for chronic digestive weakness due to spleen and kidney yang deficiency, 麻子仁丸 for intestinal dryness presenting with constipation. These formulas regulate gut motility, reduce inflammation, and influence microbiome balance. Herbal medicine complements acupuncture and supports long-term regulation. So, how do these therapies actually work at a biological level, and what's the real-world impact? Acupuncture and herbal medicine regulate the gut-brain axis. They regulate visceral hypersensitivity and modulate inflammatory pathways. Emerging research suggests effects on gut microbiome and immune regulation. These mechanisms lead to symptom reduction and improved bowel function. Quality of life improvements are commonly observed. Now let's ground them in robust evidence. Clinical trials support acupuncture in IBS. Randomized controlled trials demonstrate symptom improvement. Meta-analysis suggest improved quality of life and sustained benefits. Emerging research also supports herbal medicine mechanisms. These findings support integrative medicine approaches. So this strong foundation of evidence leads us directly to how we integrate these insights into clinical practice. Integrative treatment combines acupuncture and herbal medicine. This approach targets both symptoms and underlying balance. Treatment is individualized and dynamic. Long-term outcomes may improve through systemic regulation. This reflects the strength of traditional Chinese medicine in functional disorders. Irritable bowel syndrome is a complex functional disorder. Traditional Chinese medicine provides a systemic regulatory framework. Acupuncture and herbal medicine offer complementary mechanisms. Integrative medicine may improve long-term outcomes. This represents a growing area of clinical and research interest. Thank you.